Well, this week, the Nigeria Center for Disease Control, NCDC, is launching its Yuletide season campaign themed Celebrate Responsibly as part of the Take Responsibility campaign, which began February 2020. Now, Celebrate Responsibly focuses specifically on measures Nigerians need to take to protect themselves and their loved ones from COVID-19 during the period. The campaign targets the entertainment industry, transport, religious settings, media, security personnel, young people, and the general public to promote adherence to the COVID-19 preventive measures during this festive period. Well, joining us to talk some more about this, Professor Titus Ibekwe, a public health physician and ENT surgeon. Thank you for joining us on the program.
Thank you, Millicent, for having me again.
All right, Prof. I mean, are people really listening to the NCDC, the steering committee of the presidency, the Ministry of Health, the Primary Healthcare Development Agency, when they put out messages like this, celebrate responsibly?
Yeah, this is a wake-up call for each and every one of us. And these messages are coming through the heels of some scientific findings, evidence-based information on ground. It is presumed that people should be listening. But beyond just putting this out in the radio and television and the print media, there should be able to be a follow-up to ensure that the Enlightenment campaign is taken down to even our hinterlands, so that it will get to the extent of reaching those that are in the hard-to-reach areas, in different languages, in different forms of communications, and through people that they really trust and people they have hold at very high esteem. You recall that when we talk of non-pharmaceutical measures of protecting, you will see this mainly in our cities.
Apologies for that, audio. We'll try to get in touch with Professor Ibekwe very shortly on, indeed, this new campaign by the Nigeria Center for Disease Control.
Yeah, Millicent, thank you. I was actually explaining that there's need to also do more towards intensifying this campaign, that it is really apt to have such a campaign at this point in time, given the reality on ground that we'll have 5-fold rise in infection of COVID-19 just within this very brief period. And we're still counting because Omicron is known to be very infective. The rate of transmissibility is very high. That is one characteristic of this variant. Although the disease may not be as severe as the Delta variant, but it's transmitted very fast. It spreads very fast.
Let me ask this, and this is, Prof, if I may butt in, would you liken what we're seeing, largely this virus? Do you think that it's persisting, and this is with Omicron coming in, because of the inequality in vaccination?
This is, I would say, is a conglomeration of factors. Well, across the globe, you can mention inequality. But let's bring Nigeria into perspective. We have not consumed all the vaccines that were even donated to us. And the information out there is showing that some are very close to their expiration dates. Not up to 10% of Nigerians have been vaccinated. Yet the vaccines are there in the shelf, waiting for those that will consume them. So that's why we have to go beyond just this and look at the factors that will help us to increase the intake of this vaccine. One is availability, which I don't think is the problem right now. The second issue is the issue of good enlightenment program, to be able to convince people so that they really understand and embrace this culture of coming to get vaccinated, coming voluntarily, not being coerced in the process, because it's what you believe in that you can internalize. And the third factor here is debunking a lot of fake news and rumors that are making the rounds, especially within the social media, getting people confused. To debunk all this news and make sure that the correct information is put out there in the public space. So vaccine is one thing at the other hand, but very importantly is the non-pharmaceutical measures, which cost little or nothing. It's just being faithful and applying some level of due diligence on our own part as citizens, to use our mask, physical distancing, and also to cleanse regularly our hands and good respiratory hygiene. That's why this Celebrate Responsibly is okay, but we should also expatiate on this and keep on emphasizing that if you mustn't travel, please stay where you are. Because sometimes you may take precautionary measures on your own part, but some extraneous factors will not allow you to apply this to the end. Number one, let's not forget that this period is the period of what? Of Harmattan. And during Harmattan, the wild wind is so fast and is so dry, it's moving very fast. And these are droplets, the mode of transmission of COVID-19. So you can see that the weather, as it is right now, will be a vehicle that will also help in propagating this the more. So, and when people are traveling with the massive traveling and also, you may not be able to avoid clustering and crowding. The public transportation system, it is difficult to maintain physical distancing. But applying a lot of caution is what is needed. Those who are moving in groups, to make sure that they wind down their glasses. This is not the time to consume air conditioner and keep on recycling the same air within.
Prof, I must quickly get this question in as we head to break in just a few seconds. And this is, should people take advantage of, this Yuletide, the festivities to, rather than celebrate, go and get their vaccines?
Oh, yes, this is an ample opportunity to do this. But as I said, we need to do more individually and collectively, especially those who have been entrenched with this responsibility, NCDC, Primary Healthcare Development, Ministry of Health, and indeed all of us health workers, media people, to carry these messages down to the grassroots in languages that they understand. We should see ourselves as stakeholders. Once we do this, and carry out good campaigns. So a combination of both non-pharmaceutical measures and the vaccine will give an additive, towards a good safety measure that will help the country at large.
Thank you so much.
So that the two will be synergistic in action. Thank
we
you.
always appreciate your time. Happy holidays. Thank you so much. Professor Titus Ibekwe is a public health physician, ENT surgeon. Thanks for joining us.
Thank you for having me.